Imagine that you are a sprinter representing Team Canada in the upcoming World Championships. Over the next few months, you aim to refine your technique in the hopes of reaching the top of the podium with a gold medal. To help with this, your coach will record your movements for playback and closer examination. However, funding is very tight, and the only thing you can find for recording is a still camera. You are moving at very high speeds, and the resulting photos are blurry. As well, these individual snapshots do not provide a full picture of your overall motion. Determined, your coach borrows an old video camera, but one that is stuck on the close-up feature and that records individual frames at a slower rate than you are sprinting by. Again, you are left without the ability to fully recreate your motion for post-practice critique. On the day of your first race at the World Championships, you fall short due to poor feedback during training. Now, instead of a worlds-bound sprinter, you are a new patient presenting with shortness of breath, fatigue, and chest pain. Initial imaging suggests that you have a heart valve malfunction, but it's not sure what the direct cause of the problem is. With limited information of how your heart behaves, the surgeon attempts a valve repair. But within a month, your symptoms return. The clinical team failed to isolate and address the underlying problem with your heart. They simply didn't have the full picture of your beating organ. Heart valve disease describes a variety of problems where blood flows backwards into the heart when it should be pumped forwards to the rest of the body. While current imaging techniques can determine if blood is moving backwards, they cannot determine why the backflow exists and how to best fix it. That's where our work at Robarts Imaging Labs comes in. Using current imaging machines and advanced post-processing techniques, we are working to create a more comprehensive image of how the valve functions within a beating heart. Medical imaging allows us to non-invasively see below layers of skin, fat, and muscle to the organs below. As with any new imaging technique, we must work to verify that the images acquired actually depict underlying patient anatomy. Ultimately, this research will allow clinicians to fill in the missing pieces to the puzzle of how their patient's heart beats and what the problem is. This translates to personalized surgical intervention and improved patient outcomes. Excellent equipment already exists to improve the training of our sprinters. Let's aim to do the same for patients with heart disease. Thank you.